Have a frog in your throat? There are many conditions that can cause a hoarse voice, or you can lose your voice entirely. Dr. Steven Feinberg of Hoag Memorial Hospital Presbyterian in Newport Beach discusses the diagnosis as well as the treatment to get you talking again.
The vocal cords are what helps us produce sound. Basically, air gets driven from the lungs up through the vocal cords, and then the sound is shaped by the throat and by the mouth and then comes out as the sound that we hear. When patients have problems with the vocal cords themselves, they develop hoarseness. And it's a wide variety of problems that can present as hoarseness. We see patients ranging from opera singers that have very small problems in their upper register of their voice singing, to patients with vocal cord cancer who have no voice at all or may have restriction of their airway. In addition, we see patients that are regular voice users like professionals, lawyers, business people, teachers who develop nodules or polyps of their vocal cords. Sometimes people develop cysts of their vocal cords, and those are things that we're specialized in diagnosing as well as treating. In addition, there's a whole spectrum of neurologic disorders that affect the voice and the vocal cords. Strokes, Parkinson's disease, dystonias like spasmodic dysphonia, which is a laryngeal dystonia, and other neurologic conditions like tremor directly affect the voice.
How are voice problems diagnosed?
When you're evaluated by a team made up of the laryngologist, myself, and with the speech pathologists. And the typical evaluation consists of talking to the patient, listening to their voice, and performing an acoustic evaluation of their voice using computer software. And that gives us an idea based on the spectrogram of their voice and the characteristics that the computer picks up as to what is the specific disorder with their voice. And then we typically image the larynx. The most state-of-the-art and widely used imaging modality to look at the vocal cords vibrate is called laryngeal stroboscopy. And that's a slow motion video of the vocal cords vibrating. There really isn't any particular age group or type of patient that presents with voice disorders. Kids develop voice disorders and the elderly develop voice disorders. More so in the elderly, which is a very common problem, but all across the entire age spectrum, people develop voice disorders. And there's a huge, given that there's cancer, there's benign lesions, there's neurologic disorders, there's acid reflux, which affects the voice, there's a huge spectrum of patients that come in. So we see the full range. For patients with hoarseness, we can do a lot to improve their voice. For patients that have normal voices, we have trouble making them super normal. So we can't take a normal person and make them an opera singer, but we can take somebody that has a breathy voice and we can make it non-breathy and much more normal. Some of the more exciting newer technologies in the treatment of voice disorders are angiolytic lasers that are targeted towards treating just the blood vessel within the vocal cord, just the microcirculation that leads into a lesion on the vocal cord. For instance, with laryngeal papillomatosis, which is caused by the human papillomavirus, that lesion has a very high concentration of blood vessels. So by treating the blood vessels with the laser, you can spare the normal surrounding tissue that gives the voice its normal characteristics and treat the lesion. And so we're fortunate enough to have a laser in the office called a pulsed KTP laser, which is one of these specialized lasers that treats the blood vessels. So patients that come in with papilloma are initially treated in the operating room in order to make a diagnosis and to take a biopsy. But on subsequent visits, we can actually take them in the office and treat them with a laser and spare them multiple trips to the operating room. Because their disorder doesn't go away over time, it's a recurrent problem. And so we're able to really help those patients in ways that we weren't able to do so in the past.